Welcome to McDougall. On today's show, Dr. Sally Melgren will open our eyes about eye disease. Hello, I'm Wayne Judd. And now the man who is right several years before it was politically correct, Dr. John.
Thank you, Wayne. Thank you very much. You know, I was doing my radio show a couple nights ago. Guy calls up and starts telling me this woeful tale about how his stomach hurt so bad. He had chronic indigestion. The doctor was worried about ulcers. This has gone on for, months and months and months. They were doing the tests. They were prescribing all the drugs and so on. He says, and I eat a really good diet too. So it couldn't be anything I'm doing wrong.
Sounds
And so I was just about to take the guilt and say, well, a good diet doesn't help. But then I fixed him with the question that straightened everything out. I said, when are you going to give up the coffee?
Coffee.
He said to me, I drink tremendous amounts of coffee. He says, that's one of the things I'm trying to deal with. I just can't handle it. You know, it's amazing, Wayne, how, people won't think of the obvious. And
I'm going to interrupt you because here's finally an issue
you like
that
coffee.
You can't get me on. I quit drinking coffee 2 weeks ago, and I'm still alive, John.
And why'd you do it?
I did it because I already have more energy than I should have.
So the nervousness got to you.
And I wanted to relax and calm down. See how calm I am now?
Oh, great.
It's good, isn't it?
Well, I hate to see you on a cup of coffee. The nervousness is an obvious thing that people get, but the indigestion, the terrible stomach pains that people get, they never think about the foods they eat and the substances they drink. Like coffee is an obvious example. And this is going to maybe ruin your whole day. And that is that decaf coffee makes as much acid as regular coffee. And so somebody who's trying to get rid of that acid burn, that indigestion, switching to decaf isn't going to do it. It's not the caffeine. It's other alkaloids in the coffee that cause that horrible acidity.
Well, that's fine, because the only reason I drank coffee was for the caffeine. So I don't drink decaf either. So I'm glad. So far, I'm batting 1,000 tonight, John.
And when you were a coffee drinker, did you know where every bathroom in town was? Because it stimulates the bladder and the bowels.
Well, now that's a little personal, but I suppose so.
Coffee, people drink coffee because it is a stimulant. And
that's right.
It makes you feel keener, it wakes you up, it makes you feel more alert. And that's the positive part of that particular drug, but people need to know the negative part. And the negative part is all that overstimulation that you talked about, the nervousness, the acid,
that's right.
the bladder, the bowel stimulation. And also the heart raises blood pressure, makes the heart more irregular.
It's true that I've noticed since I quit drinking coffee, my pulse has actually gone down some. I'd noticed that just a few days ago.
When I drank coffee, Wayne, and I'll tell you, I've had some bad habits. In fact, I've had all the bad habits.
Really?
That's why I can talk about them all.
I see.
When I drank coffee, I would sit and grind my teeth together. And it was obvious to me when I would quit for periods of time that I wouldn't have that nervous habit of grinding my teeth together. I'd have to say, overall, and obviously you've come to the same conclusion, and I think a lot of people, if they would stop and think about it, the benefits from not being a coffee drinker far outweigh the benefits of drinking coffee.
And the point you make about the acids, I think, is an important one. I wasn't aware medically or chemically, but I certainly was experientially aware of that.
Well, I want to also, just to end, let you know that coffee raises your cholesterol and decaf raises it even more. So you can't win. I think you need these kinds of changes.
Let's quit right now.
We're going to come back and we're going to find out about eye disease from Dr. Sally Melgren.
Give your children a brighter future. Watch Hello Channel.
And welcome back. With me is a person I've known for several years and a person I've had tremendous respect for. You might not associate diet with eyes, but this person does. She's a physician, an ophthalmologist, which is a medical doctor that deals with eye diseases, and she's really tried to make a difference in her patients' health, their general health as well as eye disease. Welcome to the show, Sally Melgren.
It's great to be here, John.
You're trying to tell us that there's some connection between what we eat and our eyes. People take eyes for granted, Sally. They, you see at them, they seem to always work well, put a few glasses on them, but connecting disease with what we eat, that seems a little far-fetched for many people.
It's very important. I'd say just as important as for your coronary arteries, it is how you treat your body all your life, how your eyes will end up when you're 80 years old.
What kind of diseases do people get, do you see in your practice as an ophthalmologist that you think are related to what people eat?
Cataracts, macular degeneration, possibly glaucoma.
Well, people are familiar with glaucoma and cataracts, but it's macular degeneration.
Macular degeneration, yeah. In
Do
lay
you know what that
terms,
is, Wayne?
that? I have no idea.
Macular degeneration is an aging of the layer underneath the retina. There can be two kinds, dry and wet, and it takes away your reading vision. So it makes a person very unhappy when they have
Now,
it.
how old are you when you get that?
It starts most common in the 70s.
Would it be reasonable for somebody who's interested in dietary diseases and lifestyle diseases, if you said degeneration, that diet should be one of the things that comes first to mind, shouldn't it? You know, like degenerative arthritis, degenerative heart disease, and why not degenerative retinas?
Just last month, November '94, the literature shows that eating leafy green vegetables decreases your risk of macular degeneration.
And was it about leafy green vegetables or about beta carotene?
Definitely about leafy green vegetables.
Well, you
which
know,
I
a
think is
lot of our
important.
listeners would rather hear that they can continue to drink the milk and then eat the cheese and the meat and just take a vitamin pill.
Does that include lettuce?
No.
I've heard a rumor that the doctor does not think lettuce has value, so I'd love to establish value for
It's
lettuce.
great on bean sandwiches.
I see.
No, the specific components are in dark leafy greens, collard greens, turnip greens, beet greens, spinach, chard, not lettuce.
Now, would it be, just to carry a little further, this macular degeneration, would be the addition of nutrients or the lack of culprits, like most degenerative diseases we think of at both levels. For example, degenerative artery disease that leads to heart attacks. We think of that cholesterol and fat loading up the arteries, and yes, not enough vitamins and minerals and so on. Or we deal with the same kind of complex positive and negative effects here to get macular degeneration, do you think?
I'm sure it is, because the blood vessels underneath the retina are the ones that are involved many times.
So that's why putting a dark leafy green vegetable over your bacon and eggs is not going to solve the problem, right?
That's correct.
I'm glad you made that point clear for us. How about glaucoma? I would say glaucoma is the biggest worry of people as they get older. In fact, so many people are on glaucoma eye drops. You have any idea how many people in their, say, 70s or 80s use eye drops or other glaucoma medicine?
Well, I think the incidence is about 5%, but I bet the amount of people
That's in
on
the whole population.
in the
5.
whole population.
But how about older folks? It seems like every older folk
Much
I know
higher.
is putting drops in their eyes.
That's true. And one of the issues is that timolol, one of the medications used, can raise the cardiac risk ratio by lowering HDL.
So that's the same effect any beta blocker has. It raises it lowers your HDL, and so more
That's
risk
right.
of heart disease.
So I'm wanting to encourage my patients to exercise. The Dr. Passo and Dr. Van Buskirk did a study where they showed in glaucoma suspects that exercise on a regular basis aerobically for 3 months can drop your pressure 20%.
No, don't be modest now, Dr. Sally Malgren. You also did a study yourself on taking people with glaucoma and measuring their eye pressures. Tell us about that.
We did a study on 91 people, put them on a total vegetarian diet, similar to what you recommend, no refined foods, low fat, no cholesterol, and exercise, usually in the form of walking. And in just 2 weeks, John, their pressure came down 10%.
And would that be enough drop in pressure so that some people could get off glaucoma medications?
That may be for some.
Now, what if I was somebody in our viewing audience and they said, no, I'm really sick and tired of taking these drops and I don't like having glaucoma, I think I'll just stop the drops.
No, you
I'll
shouldn't.
just change my diet and stop the drops.
No, you should work with your ophthalmologist to do that. And the first thing I would say is stop caffeinated products.
Caffeine raises the eye pressure too.
Yes.
Will their ophthalmologist agree with that prescription?
Dr. Mary Lynch did a study. She's now on the East Coast, and she found that 4 cups of coffee could raise the pressure significantly. And it's a temporary effect. It goes up for a couple hours and then comes down. Most ophthalmologists would not be aware of that. It hasn't been published yet.
Yeah, that study hasn't, but there have been a lot of studies published on macular degeneration and vitamins. And it seems to be pretty common practice for routine ophthalmologists to prescribe vitamin pills to their patients, and maybe a few, some ophthalmologists, a good diet, as they become more and more aware of it, the doctors will be doing that, don't you think?
I think so.
Now, what is this truth about vitamins that you've just referenced?
Well, isn't the literature don't they talk about macular degeneration in terms of beta carotene?
Yes, there was one study that showed if the blood levels are higher in the carotenoids, there's less risk of macular degeneration. And so taking carotenoids theoretically would help that. I think it's better to eat them from the foods. But there are also cataract studies showing that a higher blood level of antioxidant vitamins prevents the cataract formation.
Okay, it's real important for our listeners to understand we're talking about eating the right kinds of foods, and vitamin pills are a secondary approach to the problem. But unfortunately, when people read these articles, they think, pill, I can continue my same old diet. Dr. Sally Malgren, she has a better idea, and we'll be back with you folks in just a few minutes.
Hello, I'm Ruth. Learning to speak English can change your life. Knowing this valuable language can provide you with so many opportunities in education as well as the job market. Now you can learn English just by watching television. Introducing Hello Channel, a channel designed to help you learn English right in your own home. You can choose from Hello Channel's classroom programming, or you can watch great entertainment. All of it will teach you how to speak English. Hello Channel offers programs on every level, so you'll find something exactly right for you. Start today to build success by learning English. For a brighter future, say hello.
And with me is Dr. Sally Malgren. She practices ophthalmology. It's eye medicine, a medical doctor in the San Diego area. And we're learning about the connection between eye disease and the fork and spoon.
In fact, Sally, until this evening, I guess I'm one of those people who never connected my eyes with the rest of my body. I thought they functioned independently. Never would have guessed it.
They'd put up with any kind of dietary abuse, right?
Absolutely. How could diet affect my eyes?
How about the cataract problem? There's another serious issue in terms of people's health, particularly as they get older. Do you think that cataracts can be prevented or maybe reversed? Or is there anything we can do with good diet in terms of cataracts?
I'm not aware of any study that would prove that it would reverse them, although I wonder that. And there are studies that show a higher blood level will slow their development.
Blood level
definitely. Antioxidant vitamins.
Of antioxidants. And again, we're talking about good food to get the antioxidants, vegetables, fruits, as opposed to getting your antioxidants from pills. Do you prescribe vitamin pills in your office?
Yes, I do. But I tell the people first, I'd rather have you eat 5 fruits and vegetables a day. That is #1 choice. And second of all, a vitamin pill if you can't eat the 5 fruits and vegetables.
Well, they must find this, Dr. Sally Malgren, an unusual conversation for a doctor, particularly an eye doctor, to sit down and talk about what they have for breakfast, lunch, and dinner. What kind of response do you get from your patients?
Mostly very positive. I have patients who have stopped caffeine when they were drinking 10 cups a day and had dramatic improvement in their eye pressure. I find a very willingness on the patient's part to participate. That's why I went into ophthalmology.
To help patients?
Because I know if you tell someone that they have a bad liver, you need to quit abusing it, they may or may not listen to you. If you tell them you're going to go blind, they generally listen to you.
Losing your eyes is one of the scariest things, isn't it? This connection between coffee and eye pressure, it seems obvious, but you know, the scientific literature is so mixed on its studies of blood pressure and coffee. And I have to say, I think the coffee industry has had some influence on that mixture of studies. Whereas it's turning out that the science these days is really showing that coffee intake will raise your blood pressure, and stopping coffee can get you off of blood pressure medication. So I don't find it a bit difficult, Sally, to make the next step and say, well, if you cut the coffee out, your eye pressure is going to go down.
You're saying we can no longer trust the research that's reported from time to time that coffee isn't so bad after all. I kind of went with that for a number of years, that probably wasn't so bad, because we'd see the research from time to time that said coffee's not so dangerous, and then there'd be a study that would say coffee is really kind of bad for you, and then I'd quit for a while, and then there'd be another study that would encourage me to get right back on coffee again.
And I bet you liked the studies that said it was okay
I
to
did.
drink coffee.
I confess. Those are the ones that I thought were the most authentic, in fact, and you're saying probably they aren't.
Yeah, people love to hear good news about their bad habits. And that's basically why we listen to those particular studies. Yeah, there is a lot of confusion out there, and some of it has to do with scientific technique, and some of it has to do with just plain misunderstanding. I'll give you a good hint, Wayne. Good story here. Some of the studies showed coffee would raise cholesterol. Other studies showed it wouldn't raise cholesterol.
Yes.
When they got down to the scientific method to figure out what was the difference, those who boiled their coffee and fed it to their subjects raised their cholesterol by about 10%. Those that used coffee filters, what happened is the filter paper filtered out the substance that raised the cholesterol. So it depends on how you design the experiments.
Interesting.
And, you know, it may turn out to be with other diseases such as raising pressure, eye pressure, and so on.
We need more studies.
There are a lot of good things. If I was going to go back into medicine, Sally, I would pick a field where I could do a lot of good for people. And as an internist, often you're frustrated by the fact that there's so little good you can do for folks. But as an eye doctor, in addition to helping people with good diet, helping prevent problems, I mean, you have so many wonderful tools at hand where you can help people. Don't you find it a tremendously rewarding profession?
It's very rewarding, John. I really enjoy it. To see a person say, oh, I can see colors again. This is like, can't remember this for 20 years. It's very exciting.
And you're talking about what surgery there?
Cataract surgery.
And you perform that?
Yes.
Somebody told me that this was a serendipity. The cataract surgery was a result of an accident. Did you tell me that story?
Yes, I did, about the PMMA plastic in a person's eye, an airline accident where windshield from the plane got in the eye and it was biocompatible, and they thought, hey, this would make a good intraocular lens.
So from an airplane accident, they decided that it would work well. And even in my own family, my father had his cataracts replaced, and it was a miraculous and marvelous. And there's so many things in medicine that are questionable, where there's in eye surgery, you have this great tool of cataracts. How about radiokeratotomy? I'm
a little biased on that, John. I don't perform
I'd like to hear your bias, Sally.
I don't perform it because I don't think it's a physiologic surgery, I'd say. We take the eye, the cornea, and cut radial incisions in it, and it weakens it. Not only that, when the pupil dilates, the light comes in and hits those scars and can cause glare. And the recent study out, the PERC 10-year study, shows that there is a progression of the effects. So in other words, a nearsighted person who's made normal then starts to progress to be farsighted.
And they don't put that in the advertisements.
No.
And there's whole centers built on radiokeratotomy. It's quite a business.
Let me say it is very effective. Most of the people who have it done just love it and will say they do it again. But I wouldn't have it done on my eye.
And what you wouldn't have done on your eyes, you certainly wouldn't practice. Dr. Sally Malgren, she wants to keep her patients healthy, and she talks to them about good diet and also very effective surgeries. And there's all kinds of things that this woman does for her patients that really makes her a different ophthalmologist. And we'll be back with you folks in just a few moments.
Hello. The job market is a competitive place. In today's economy, extra skills mean a better job for you. Speaking English is the skill you need for greater opportunity, more money, and a brighter future. Introducing Hello Channel, an exciting new television channel that teaches English as you watch TV. There's something for everyone, and the more you watch, the faster you'll learn. All you have to do is say hello.
Why don't we all go rollerblading tonight?
Oh, not tonight, honey.
Mom, spending time with me now means having a better chance of being close to me when I'm a teenager.
Give your family everything. Give them your time.
And we're talking about eye disease. As Dr. Sally Malgren told us that losing your sight would be the greatest threat to any individual. So think about that next time you have breakfast, lunch, or dinner. It could be threatening your sight. And we're also talking a bit about surgeries. That radiokeratotomy is the biggest seller around.
You know, I have a son who had radial keratotomy, and he was back for Thanksgiving. And one of the things he said was that that's the best $2,000 he ever spent. One of his eyes held, and the other one hasn't. He does not have adequate vision out of one of his eyes.
And both were operated on, Wayne?
And they were both operated on with the incisions. Now he's wondering about the laser technology and where that is.
I think excimer laser is the new upcoming exciting treatment for nearsightedness. I think it's going to replace radial keratotomy. It's going to be more expensive, but if I were going to have a refractive surgery done on my eye, it would be excimer laser. That's where we take the laser and flatten the eye by just shaving off, or ablating, we call it, the tissue.
You think there'll be fewer side effects and better results with that?
Yes, I do.
Technology coming through again in the eye business, and that's what people are looking for. Everybody's looking for high tech. Doctor, fix me. You know, it happens to be our attitude, and of course doctors are very willing to do that because that's their business. And but when you tell somebody, Sally, that the way they fix themselves is by their own actions, how about vascular problems? You must have to deal with this all the time. You know, vascular problems that affect the heart and strokes and so on. As an eye doctor, vascular problems caused by atherosclerosis, which are due to the uncontrolled fork and spoon, that must enter in your practice.
I want to interject right here, John, that Thomas Edison said that the doctor of the future would he won't use drugs, he'll interest his patient in the care of the human frame.
Well, he had a great bit of advice, didn't he?
That's exactly what we're talking about. And vascular disease in the eye. Vascular disease in the eye is significant. We can actually look in and see hardening of the artery where it's crossing a vein. It'll make an indentation in the vein. You can actually see the hardness of it, and it can clot off that vein, and all the blood backs up, and you lose your sight.
Well, you don't even have to wait for that. As I remember, you know, you look in the back of the eye and you can see the blood vessels thickening and with the atherosclerosis and the effects of diabetes. And so I used to scare my patients with that. I would tell them, I'd look in the back of their eye and say, you know, those eyes look like an 80-year-old man. You better do something about that. And of course, they'd be in their 40s and they'd get a little bit scared. But it is a window to the rest of the body, isn't it?
That's right. For diabetes also, you can see all the hemorrhaging and the weakness of the vessels.
And as an ophthalmologist, as a medical doctor taking care of eye problems, diabetes is a big deal, isn't it? That's
Yes.
a big part of your practice.
Absolutely.
And there's another dietary disease, diabetes. Adult-type diabetes is an easy one for people to relate to, but even childhood diabetes is believed, and I'm one of the people that believes it, along with a good percentage of the rest of the medical community, this is a disease of an immune reaction to dairy protein in young children. What happens, the dairy protein goes through the gut into the bloodstream. The body makes antibodies to the dairy protein, but they're not specific just to the dairy protein. They also circulate through the blood and attack the pancreas and destroy the child's pancreas. And the after effects, I mean, these people go blind. What can you do for a diabetic person to help them with their eyes?
Decrease the fats in their diet and increase their exercise level.
So even these folks, you can make a difference as far as the outcome. Two studies that I remember, Sally, one by Van Eck and another by Kempner, written in the 40s, where they actually reported that diabetic retinopathy could be reversed. And they fed people a diet of rice and vegetables and fruits. But that information has been largely ignored. Did you learn that in medical school in your residency when you went through?
No, I didn't, John.
That's it.
Why not?
Why not? What a sad situation. I bet you learned about all the high-tech things in eye, which are extremely rewarding. Do you think that in terms of eye disease, you're able to finagle enough interest in people so that they're going to save their breasts and their uteruses and their heart? Do you go into that type of thing, or do you just keep it to eye problems?
I mainly keep it related to their eye, but it's interesting, since I'm a subspecialty, people will come in and complain about their general problems to me because I seem safe. I'm not in that arena. And so sometimes I'll speak to that
And
too.
when do you hold the cooking classes?
I don't give cooking
You don't
classes.
have cooking classes?
No.
Well, I think you ought to extend it to the cooking class part and really, you know, really be a practicer of what you believe.
I'll have you and Mary come down and
Thank you,
do that.
Sally Malcolm. You got some great ideas. Sally Malcolm has really opened our eyes to eye disease. Thank you very much for being with us. And we'll join you next week.